Hi, it's Gerald Major back with hashtag C Arthritis, reporting from the Canadian Rheumatology Association Allied Health Professionals Annual Scientific Meeting, and I'm honored and pleasured to be sitting beside Kiran Dhiman.
Yes.
I'm going to let you basically introduce yourself to the audience and let us know what your role is in rheumatology.
Sure. So I am doing a master's in public health at the University of Saskatchewan. So I have a lot of lived experience with arthritis. So my mom was diagnosed about 30 years ago with RA. So she's dealt with 2 hip replacements, mental health challenges. I was actually her caregiver when I was a teenager. So a lot of different aspects there. I was diagnosed with GIA, so juvenile idiopathic arthritis at the age of 9. And my partner of 2 years has vasculitis. So there's a lot of different rheumatological things happening with me. And so from those lived experiences, I knew I wanted to make the experience better somehow. So I got involved with the Arthritis Society in 2009, and I've been volunteering with them since. And I knew that I wanted my career to be involved with arthritis and rheumatology and making things better. So.
That's beautiful. I mean, not that your family's been impacted like this, but that you're doing this because of that. I end up where I am today because of my arthritis. So it's nice to see at different ages. So how has your journey been? Because I was presenting with symptoms in 1986, which was 19 years before biologics came to my disease area. So what's different now from treatment?
I would say a lot. So when my mom was diagnosed, that was a really long time ago. And really, arthritis care was simply, here's some pain medication, here's a cane or a wheelchair, and that's all we really have for you. And you could see that. So she needed a joint replacement. She has joint damage and those kinds of aspects. Or for me, my experience, I ended up in remission at the age of 16. So just that generation, things have changed drastically.
So when you say remission, what did it take for you to get into remission?
Lots of years of medication. So I was on prednisone for a long time. I was on methotrexate from 9 years old to 16 years old. And then finally I was able to come off medication, and it's stayed that way since. So
wow,
that's great.
Good for you. Obviously, you have life tips that you employ yourself, and that you've probably employed for your mother over these years. So tell us about some of the things that work for you.
Oh wow, really trying to make time for self-care. I know that's really hard to do, especially when things are busy and you have so many challenges, but really taking the time to go for that physio appointment, going for that massage appointment, whatever you need to do, because if you're not feeling well, you can't help others, you can't do what you need to do, and so taking time out to do self-care, I think, is kind of the biggest thing.
So, I mean, in some ways, when you get arthritis, you get the opportunity to then take care of yourself. But that's the whole saying that we used to use a while back, that, make sure that you're taking care of yourself so that you can then better take care of others. So how old were you when things started happening for your mother and you became primary caregiver? How old were you then?
I was 16. Yeah. So I was just graduating high school, and that was when her hips really started deteriorating, and she had a lot of trouble walking.
And so as a child at the time, how did you process that? I mean, you must have gone through a time when you didn't really understand what was happening.
Yeah, for sure. And then at the same time, she also had mental health challenges, and so there was so many different factors taking place. I think when I think back on it, I was really angry. I was wondering, why her? This doesn't need to be happening. So I think at the time, that was how I dealt with it, which wasn't always the right way to do it, because getting frustrated doesn't help, right? And so I had to take a step back and say, okay, what do I need to do to process this in order to better help my mom? And so I would go to therapy. And I would talk it out, and that's how I started dealing with my feelings, and that's how I became a better daughter and a better caregiver for my mom in that sense.
So you would know and appreciate the value in caregivers.
For sure.
I mean, some people don't like that term, but you know, support for your loved one. Do you understand what kind of role you can play now in that whole aspect of it? I know you're in rheumatology, but the fact that you've been a caregiver for your mother at that age and also in this space, what I'm trying to say is I don't think caregivers get enough attention.
Oh, absolutely not. Yeah.
And I think, so do you have any plans on doing anything from a caregiver perspective?
I've always been interested. I just don't know where the opportunity is. So, I mean, I would love to do it. Yeah.
So we'll exchange information.
Sounds
I
great.
think that's the good start. You know, you can't get better in this disease, in my opinion, really, without a lot of things working well. I talk a lot about nutrition and exercise and mental health. Unfortunately, you know, the answer to fatigue for me is exercise, and the answer to mental health is strong mental health. And you have to find ways in which to grab that. And the fact that we haven't spent a lot of time talking about caregivers and putting tools in their hands in order to do this is, I mean, as far as I'm concerned, is a massive opportunity. The way I went through life and being a young man with ankylosing spondylitis and psoriatic arthritis, I didn't understand a lot of it myself. So having to try to explain it to someone else that doesn't live with it and doesn't understand it's very hard, and I can imagine so hard and frustrating for the caregiver in those cases. So it sounds like you've found a way to kind of navigate through that. And I mean, at 16, 17, 18 years old, identifying that you might want to go to counseling to talk through this is pretty remarkable. So you have an abstract at this year's conference, so tell us a little bit about that.
Yeah, so my abstract is about a program that was developed by Dr. Diane Lakai. It's called Making It Work, and it's for people with inflammatory forms of arthritis to deal with workplace issues. So I was looking at how relevant is the current program to people who have osteoarthritis. They're a different population, they may have different needs, so looking at the differences between them.
So what are you finding?
So it seems that osteoarthritis needs more attention to pain management in the workplace. Pain seems to be more of a concern in these individuals. Also, the discussion around joint replacement and how to navigate that with your employer seems to be a really important issue, and how to disclose arthritis. I think that's common between both inflammatory and osteo, but how to have those conversations with your employer is something that's also came up.
I mean, those are big topics and big questions. I mean, my employer, the people at my employer were always great with my condition, so I didn't really face the challenges that some people face. But it's important to think that if we're going to start to ask people to be taking care of themselves so that they can be taking care of others better and working better, then you would have to have the allowances at your workplace to either do the physio or the massages. I know that in my workplace they used to bring massage in, and there's a lot of programs in that. So what are you noticing in work and how things have shifted, or have they shifted, or is there a lot more shifting that needs to happen as far as disclosing for arthritis patients? And by the way, I mean, we are the leader of workplace absenteeism. So you would think it would be a topic that's already being discussed. Yeah,
I mean, there's a lot of different issues. So, I mean, disclosure can have sometimes negative consequences. Some of our participants did say that. They said, well, you know what, things didn't go well when I did that. I'm noticing even when my mom was working, when she had arthritis, her coworkers wouldn't be receptive to what she was telling them, saying, I'm in pain, I know I can't do this task, can I do something else? And they said no, even though one of her managers did have arthritis themselves.
Right.
I thought that was very strange. But yeah, and also I don't think we do a good enough job to give people those health benefits that they do need in order to access self-care. I noticed that a lot of the times we're working towards more temporary work or more part-time work where people can't get benefits, they can't access benefits. So self-care becomes harder and harder when these structural issues are coming into play.
Yeah, I mean, I love the programs that are coming around now. I mean, just from a patient perspective, you need as many tools as possible because only 5% of them are going to work for you individually. Um, so what's next for you? Where are you with school, and what are you going to do next?
All right, so I'm almost done my my master's. I'll be graduating in June. I really love chronic disease prevention. I love patient education and those kinds of things. So that's what I'd like to end up doing. And eventually in the future, I'd love to do rheumatology.
Excellent.
Yeah.
Do we have any questions from the audience?
Yes. Do you have any advice for people that have mental health issues that go along with the disease but are afraid to ask questions due to the stigma surrounding it?
For sure. Definitely stigma is huge. Also, it's cultural as well. So I know for me, being South Asian, the stigma around mental illness was huge. And so my mom trying to seek help, she wouldn't seek help for a long time. And that was just due to stigma, and it just got worse and worse. And I said, it got to the point where she just wasn't functional.
Right.
And so she just had to go seek help, and she admitted it was better that way to just go for it. I know it's definitely a challenge, but if you can find ways just to talk maybe to other people, maybe talk to like culture groups or just talk amongst your friends or family, and maybe not going to professional help right away if that's stigmatizing for you, if that's a challenge. Maybe just talking to people who are close to you and then maybe branching out from there. I know a lot of people use religion or prayer as a way to cope with mental health issues. So maybe using those tools first and seeing how you can help yourself in that way.
And in relation to work, how can employers help patients living with arthritis? How can they develop a program, or what will make it easier for the patients to disclose or to share their information that they have arthritis?
I think employers need to understand what arthritis really is and how it functions day to day to patients or for patients. Because I know with patients, sometimes like it's quite an invisible disease, so it's hard to tell how a person is feeling. So what somebody sees, they see maybe somebody looks fine, but they're not actually fine. So really understanding what arthritis is, I think, can be really beneficial to people who are at work or managing employees.
Is that it? Okay, well, I mean, this has been a pleasure. I thank you for everything that you do on the caregiving perspective. I think I wish you really a lot of well in your career and with school and everything. I think you're on the right track, and it's nice to see the passion that comes from experience guiding the rest of your career. So that's beautiful, and good luck with that.
Thanks for having me.
Yep, thank you.